Please note this video was filmed during the COVID-19 pandemic. For the latest maternity service advice and information about COVID-19, please visit our dedicated site at www.mtw.nhs.uk/COVID-19 maternity information. In this video, we're going to be talking about your fetal monitoring options when you're in labour. Monitoring your baby's heart rate is one way that we can assess their health. As you'll be aware, when you come to your antenatal appointments, we will have a listen into your baby then, and we continue to do that during your labour. Listening into your baby's heart rate regularly during labour gives us and you reassurance that your baby is okay. There are two main ways that we can listen into your baby. One is intermittently, so at short intervals, and the other is continuously. We will discuss each one of these in turn, and we'll also show you how we do it. So the first method that we're going to talk about is intermittent ausportation. Now, as the name suggests, it means that we listen to your baby for short periods of time rather than continuously. Nationally, and here at Maidstone and Tunbridge Wells Trust, it is recommended that midwives listen in to your baby every 15 minutes for a minute during the first stage of labour, and every 5 minutes for a minute in the second or pushing stage of labour. Generally, if your pregnancy has been low risk and uncomplicated, we would recommend this form of monitoring for your baby in labour. One way that your midwife can listen into your baby is with a pinard. It works by the wider end being against your abdomen and this being against the midwife's ear. The one downside to using a pinard is that the midwife is the only person who can hear the baby's heart rate. You won't be able to hear. So this is why midwives generally will use sonic aids. With the sonic aid, the midwife will use the little probe and put it against your tummy to hear your baby's heart rate, and the sound is amplified through the monitor. You may have seen these used by your midwife at your antenatal appointments. The blue colour means that this is waterproof, so if you are having a water birth or a water labour, then it can come in the water with you. The aim during this is to disrupt you as little as possible, so it can be used in whatever position you happen to be in during labour. The midwife may just ask you to move ever so slightly if she's having trouble picking up baby's heart rate, but generally you can still move around and do whatever it was that you were doing. The midwife will always ask your permission before listening into the baby's heart rate. If you have any specific preferences, such as if you want the volume turned right down or anything else, then please just let us know. During your pregnancy or your labour, we may recommend listening into your baby continuously during labour, and the main way that we do this is with one of our CTG machines. How they work is they come with two probes, both of which go on your abdomen, and they're secured in place with an elastic band each. This means that you're then still able to move around and be mobile and keep upright during your labour. One of the probes listens into your baby's heartbeat, and the other one monitors your contractions. Both of these then print out on a graph, so then the doctors and midwives have a visual representation of your baby's heart rate in relation to your contractions, which we look at all the way through. When you are being monitored continuously on one of these machines, every hour we ask another midwife or doctor to come in and do what we call a fresh eyes assessment. So this hourly review doesn't mean that there's something wrong with your baby's heart rate, it's just something that we do routinely here. Recommended that it would be beneficial for your baby to be monitored continuously throughout labour. This can only be achieved here at our delivery suite at Tunbridge Wells Hospital. Please ask your midwife to discuss with you your fetal monitoring options and how this will impact your place of birth during your pregnancy. Another way that we can listen into your baby continuously throughout labour is with something called a fetal scalp electrode, or an FSE. Now, we would only ever use these if we had recommended that we listen to your baby continuously and we were struggling to pick your baby's heart rate up with one of the probes that we mentioned earlier. The FSE looks like this, and it's a little clip about the size of a small fingernail which we attach to your baby's head, and it then attaches to the CTG monitor and creates the same graph that we had before. Once the fetal scalp electrode is attached, we then stick a little pad onto your leg just to keep the wire out of the way, so then you can still walk around and move around and be as mobile as you have been. The fetal scalp electrode does not harm your baby, but you may notice a small mark on their head when they're born. This should heal very quickly. Please be assured that we do not use fetal scalp electrodes routinely here, and we would discuss the risks and benefits with you and your birthing partner before putting one onto your baby. As we mentioned previously, listening into your baby's heart rate can give us and you reassurance that your baby is okay. We would recommend having a discussion with your midwife or doctor during your pregnancy to discuss the risks and benefits of all of the fetal monitoring options and what is going to be best for you and your labour. As with every topic that we discuss in these videos, every aspect of your care is a partnership and every decision is made together with you and your healthcare professional. So if you're not comfortable with any of the recommendations that we make, or you have further questions, or you'd like to talk about it some more, then please let us know so we can make an individualised plan of care for you and your labour.